Originally, I'm from outside of Chicago, actually a town almost the same size as Shelby when I grew up. Is in Joliet, Illinois. It's about 30 miles outside of Chicago, just like Shelby's about 30 miles outside of Charlotte. Well, the reason I chose to come to Cleveland County, you have to start with I was at the Mayo Clinic for approximately 20 years, and several of my colleagues at Mayo had come up here and already started a practice, so they already knew the area, and I came up and I joined them. The reason they chose Cleveland County, and the reason I like being in Cleveland County, is because it's an area, for one thing, where the patients are quite appreciative of their doctors. It's somebody where you get to see the patients first. You're about 30 miles outside of Charlotte, so that you've got a place to refer patients to. In addition, you can refer patients to Wake Forest. But you're seeing the patients initially, you see them back, and the patients are some of the kindest people I think that I've ever seen. So if you've been around a demanding group of patients, whether it's on the East Coast or the West Coast, you come here. The level of malpractice is less because you have other places that you can refer people to, and quite frankly, it's a more reasonable group of people in general. So it's a more relaxed area. It's not green acres, but it really is an area I think that I've enjoyed living in, and I know all my colleagues have, and none of us have left since we moved here and settled in with our roots and sent our children to school here and have become, I hope, parts of the community. Well, I've got quite a few children, so it's gone in three ways. I have one daughter at Chapel Hill who loves Chapel Hill, and I think as our state university is very happy with that. And I've had other children who've gone to the University of Texas, and I really believe that Chapel Hill is no comparison. So that is a huge plus for the area. It's got a variety of colleges everywhere. So if your child didn't want to go there, you've got Appalachian State, you've got Davidson, you've got Wake Forest, you've got schools all over. My other children like coming here. They like the schools here. I've been quite happy with them in general. I like the size of the community. It's a little different than most communities of this size. The hospital's got about 100 physicians on its staff, which if you look around at smaller communities, if you like smaller communities, most of them don't have specialists. We've got a good, solid surgical group, which means that we can take care of things and get things taken care of easily. We've got nephrology, we've got neurology, we've got all those things. But in addition, we've got an integrated group going on with what goes on in Charlotte. For example, if I do a CAT scan here and I need to review it with a thoracic surgeon there, or if I need to review it with a neurosurgeon, if it happened to be an ICU case, they're looking at the same screen that I am. So they're looking at all the material. The chart is totally integrated, so when they do things there, I can look up the patient and see what's going on, and they can see their discharge summaries. I can get back and forth. So the ability, once you're in the Carolinas system, to see what's going on with the patients is fantastic. For a community of this size, the technology is probably going to be better than anything you're going to see anywhere else. If you look at CAT scanners, everybody's got a CAT scanner. Everybody's got a blood gas machine. Everybody's got a chemistry group. What makes it different is who's looking at it. And so if you want your scan reviewed by somebody, you can talk to the chest radiologist, you can talk to the neurosurgeon, and they're going to review it on the exact same screen. You don't have to mail something from one place to another and go through all that. So you can in real time get help with difficult cases. In addition, more than the technology, if you take a look at the breadth of the hospital staff, in general, you can get everything taken care of. We have, it's a small community. You've looked at small communities, and I've got satellite offices in some of them. I mean, frequently there is nobody there who can help out with a case, so those cases have to move. Some of the cases here you keep for a while, you partially work them up, and then if they need treatment, then you refer them here. Well, first you got to look into your own heart as to whether you want to be in a community this size. If you're an urban person, Shelby's not an urban area. It doesn't have, the ballet every night. It doesn't have those things. But what it does have is a safety factor and, as I say, a population of kind people, so that if you want that as part of your community, and that's the most important thing that you have, then I think that you're going to like Shelby, because in a community of this size, where you get to know almost all the people, you end up becoming it's almost a celebrity around town. When you go through Walmart, you know half the people going through there. When you look at that, if that's what you want, and it's important for you to start to know all those people. Shelby's got more medical resources in a community this size than almost any other community. So you're going to pick what it is you want. If you wanted to go to New York, I got news for you. Shelby's not New York. On the other hand, if you wanted to go to a suburb of New York, just like Shelby's a suburb of Charlotte, I'm like, not bad, because you're going to go into the restaurants of Charlotte. You're going to be going into Charlotte. It's an easy trip in. And you're going to be in a smaller community where it doesn't take me an hour and a half to get to work. And I don't have to battle the traffic. I'm in here in 5 minutes. I can do things easily. I know the guy at the grocery store. I know the guy at the gas station. I mean, I sound like the Cheers commercial. Everybody knows my name. And so it's helpful in that sense. So I think you got to decide what it is you want. If you are an opera symphony fan, I would not suggest that you come to Shelby. But if you are a fan of how your life is day to day and what's easier to do, whether it means going to the gas station, which in Chicago takes an hour, whether when you have to go for groceries in Chicago is an hour and a half, then I think Shelby's going to be a place that you like. And so you want to talk about what can you do versus what can't you do. I'm with my children all the time. My kids are in sports, they're participating in things. It's easier to conduct that. And when you take a look at that, I mean, I've got my daughter in Suzuki violin. We've won the state violin championships regularly. I have one daughter who I adopted from China. She's taking Chinese here with a tutor, which makes it, I think, wonderful. When we talk about the sports, whether it's the YMCA leagues or the Greater Cleveland County leagues, it's been great for my son. When you talk about higher education, just using North Carolina, you are not going to beat North Carolina. I mean, it's just not going to. I saw that Chapel Hill won the best value in North Carolina, but more than the best value, my oldest daughter went off to prep school at Andover and then speaking Japanese there. Well, Chapel Hill's been wonderful. I was able to get her over to Japan and Asia and study over there, and I paid state tuition. And I just had to pay for the things. I'm like, where else are you going to do that?
Chapel Hill's actually won best value in the country several different times, not just in North Carolina.
No, it's clearly the best value. I also would argue it, though, that it's probably the best school. I think, I've looked around at a lot of them. I think it's really
You're not
superior
it's
institution.
better than Duke, even.
Well, my daughter, I gave my daughter a shot to go to Duke. They had some scholarship, and she goes, well, I've given them a certain amount of money. She said, why would I pay the extra amount to go to Duke and do the same thing? So she goes over there and takes classes over there, too.